We have immediate access to expertise from a CMS regulatory perspective, from a commercial payer perspective. How does the commercial payer want to be paying for that product or service going forward? And an operational perspective, because we have physicians who are used to the practice line that may be implicated by the investment. They're fully familiar with the pharmaceuticals being utilized, the medical devices that are currently standard of care but may be coming online. All of those things are able to bring to the table in perspectives, and we understand the client's need to be quite efficient about that, and therefore we utilize not 20-somes who are first trying to understand this from a web research perspective or making a few phone calls, but we're calling on the decades of experience that our advisors have under their belt and asking them to come to the table pretty quickly in a focused manner to meet the client's timetable. Our biggest differentiator is clearly our people. The people that we are able to bring to bear on these assignments make all the difference in the world. So let's take a few examples. Leslie Norwalk, she grew up in our organization, went off to CMS, served at very senior levels, and ended up running the place before she came back to us. She brings to us just intimate understanding of what the hot buttons are for that agency as it comes up with payment policy for the various sectors that our clients ask us for our opinions on. We have Bob Atlas. Bob Atlas has been building HMOs and other health plans for 30 to 40 years. Bob Atlas ran the early operational consulting shops that brought so many plans from nothing to being some of the most prominent plans that serve the insurance community today. He is deploying that insight for provider-sponsored plans and for state Medicaid programs that are trying to run more efficiently today in many instances. We've got Tom Hutchinson. Tom knows more about risk adjustment and the intricacies of Medicare Advantage payment than probably anyone else on earth. And so many payers and providers are so dependent on a deep understanding of that system that they very much enjoy the opportunity to pick Tom's brain and to develop strategy based on what Tom can suggest to them as to the direction of Medicare Advantage payment in the areas that they are anticipating investing in. And Dr. Sam Nussbaum, I would be remiss to leave him off this list because he is the synthesis of the commercial insurer's perspective, but also the large academic medical center provider's perspective. Having been a senior executive at BJC, one of the nation's premier academic medical centers, but then for many years, Anthem, the nation's second largest insurer's chief medical officer, and helping Anthem think about how it could structure value-based purchasing arrangements between itself and those large medical centers.